Hello, PHARMATIVE members. This is Dr. James Partika. I'm a clinical pharmacist, research scientist, and the founder of PHARMATIVE, and welcome to the first part of PHARMATIVE Live. This is my opportunity to get to know you better by you texting or emailing me your questions, your feedback, your suggestions. So please feel free to do that. PHARMATIVE Live is going to be a recurring part of PHARMATIVE. We're coming to you live from San Francisco, California. And I want to shout out to all my friends and family out there throughout the country, as well as in the world. Hello from me to you, and welcome to PHARMATIVE Live. Again, this is our opportunity to answer some of your questions, get your feedback, and we plan on doing this on a regular basis. The first question that I most commonly receive over the past few years is, what the heck is PHARMATIVE? And PHARMATIVE basically is a new private social media network which is dedicated to your healthcare. So I have subject experts and advisors and contributor leads throughout the country, specifically experts in various aspects of healthcare, who will provide you with practical information to help you take care of your healthcare, your health, your loved ones who are sick, and so forth. We're trying to provide to you basic information. For example, what are the first 3 questions you should ask a new doctor when receiving a physical exam? Or what is the difference between aspirin versus Tylenol versus ibuprofen? Questions like that matter to taking care of your illnesses and your health on a daily basis. We're also, PHARMATIVE is going to be providing medical breakthroughs in the treatment of cancer, Alzheimer's disease, and a number of other chronic illnesses, again, to empower you, to allow you to take charge of your health care, which is so important. So PHARMATIVE is a multimedia company, and we provide healthcare materials on various topics, and we're organized by healthcare channels. And what I'd like to do is actually take you inside PHARMATIVE. But before I do that, I wanted to make a few assurances and promises to our members. And the first and foremost is that PHARMATIVE will always be forever free, so that this information is available to you 24/7 at no cost to you. PHARMATIVE makes its dollars in order to reinvest into the company or for various charities through advertising. And those advertisements are clearly labeled in the PHARMATIVE trending feed. When you see that, it'll say advertisement, and if it's from PHARMATIVE, there'll be either the PHARMATIVE logo, the PHARMATIVE name, or a disclosure of where this information is coming from. The second thing I want to assure you of is the only information you need to enter into PHARMATIVE.com website is a valid email. You need to confirm that email. And secondly, establish a username and a password for yourself. That's all that's required from you. Any additional information that you decide to share with other PHARMATIVE members, or you decide to post on your trending feed or on our trending feed as a comment, you're more than welcome to do that, but that's a voluntary thing. So I just want to assure you that we're doing everything with regard to cyber security and levels of encryption to ensure you that any information that is stored in PHARMATIVE.com is protected, and you can be assured that outsiders will not have access to that information, or we accidentally release that information to a third-party vendor. So those are my promises to you, and again, I welcome your feedback. You can either send a text right now live through Facebook Live, or you can send us an email through at info@pharmative.com. So when you log in to our website, you'll see our logo. And basically we are, which is very exciting, the first private social media network dedicated to healthcare. And again, who is it for? It's for everyone. It's for the patients. It's for the doctors. It's for scientists. It's for technologists, technicians, nurses. It's all inclusive. It's also for the caregivers that support our elderly members and friends. So again, it's a positive platform. We're going to give you the facts. We're going to reference the material as appropriately. And we will disclose any information as necessary as far as financial conflicts and so forth. So again, PHARMATIVE.com is for everyone. And I can envision a point in time when we're allowed to develop channel networks within PHARMATIVE for various communities and organizations to establish their own healthcare problems, healthcare awareness for those problems, and so forth. So stick tuned, there's lots more to come with regards to PHARMATIVE.com. So you come to the main menu, and if you want to join, you just want to click on Join for Free. And if you've already joined as a PHARMATIVE member, you just want to go to the login menu. It may or may not remember your username and password depending on how you set up your security settings. And then if you scroll down, you'll see me and our mission statement, which really is fundamentally about sharing ideas and innovations to ultimately improve healthcare. That's our mission. And our mission is to work with other organizations, student organizations, schools, professional organizations, to again provide you the best information in real time through a positive social media network platform. That's PHARMATIVE. And so inside PHARMATIVE, you're going to see different ideas and generations and different video clips and inspiring photos and biographies, again, all to provide you this very complicated information in the simplest way possible so that you can clearly understand it and convey your needs to your healthcare professionals. We will eventually be launching PHARMATIVE for networking, so there'll be career opportunities and career jobs in healthcare board for various postings of jobs. We are going to be providing communication throughout the world, hopefully. Right now I know of members that are in Europe, and so I want to shout out to them, hello. But also we're on various platforms. We're on all the major social media websites, including Facebook, Instagram, YouTube, and Twitter. So look for us there as well. And finally, it's about collaboration. Collaborating with each other about the needs of our loved ones and as well as our pets. I made a decision very early on in developing PHARMATIVE with my creative director, Jimmy Mann. Hi Jimmy, I'm sure you're out there and I'm sure you're watching. That we would also include living things, our animals and our pets. So I have a subject expert named Jen Bueller. She's a veterinary technician, actively practicing in a veterinary hospital and clinic. And she provides real-time information about the health of various animals, cats, dogs, gerbils, pigs, you name it. She knows about it, and she'll be relaying that information. I was really impressed with Jen's very first blog article, which was on if a natural disaster happened in your neck of the woods, do you have a rescue plan for your pets? So if you went on to Animal Kingdom at PHARMATIVE.com and looked up Jen's first article, and you can do that through our search menu, you'll get the information of what she's recommending for you to develop a rescue plan for your loved pets. So that's on Animal Kingdom at PHARMATIVE.com. And now what I'd like to do for all of you is share with you our healthcare channels. Right now we have more than 16 healthcare channels. And before I do that, and again, we're live here, there's no editing going on, and there's no one pulling strings behind my back making me work hard today, but I'm here for you, and I'm here for PHARMATIVE.com to help you. And that's what it's all about. It's about helping people. A little bit about my background. I'm on LinkedIn, so you can look up my credentials, but I've been in healthcare for over 20 years. And I'm a licensed healthcare professional, pharmacist, as well as a board-certified pharmacotherapist. And I've worked in multiple settings, including the hospital, outpatient settings, as well as the cancer center. And then now I work in pharmaceutical industry and cancer research. So again, I have a certain level of expertise. I don't know everything, but I know people who do know various experts in various areas of medicine. And I certainly would like to connect you with them as well so they can share their expertise with you as well. So when we come into PHARMATIVE.com and you're logged in, there's a file menu up here that you want to click on. And you want to basically scroll down to Find and Join Networks. And I'm looking for it right now. There we go. All right. And you search for your networks, right? Find and Join Networks. And a whole list of over 16 channels will come up, and you basically read through them and decide if you want to join them or not. And so the next time when you log into PHARMATIVE, those networks, those channels of healthcare that you decide to join will populate your trending feed and provide you specific information to what you're most interested in finding out, information. Again, I feel like I'm a very bad weatherman right now because this is a live demonstration of our database and our social media workspace here. And it's always difficult and challenging to basically do a live demonstration, but we're going for it. We're going for it. So Food Science is a channel, and it's led by Sarah Eisenberg, and she is a healthcare wellness coach and instructor, and has an extraordinary talent for writing and blogging about healthy foods. So if you're a foodie, and if you're a healthy foodie, you want to check out Food Science. So you would just click on the table here, and that'll bring you into Food Science Network. Okay, second one I have already mentioned is Animal Kingdom. Jen Bueller's a vet tech, and she provides real-time information about animal care and animal health. So check that out as well. Take Charge is all about empowering you with information in order for you to make wise decisions about your health care. For example, I'm a clinical pharmacist, and when we're talking about the appropriate use of medicine, we have to weigh the benefit versus whatever risks of side effects there are versus the cost. And we'd like you to be more aware of the cost. When is it a good time to maybe choose a generic drug like ibuprofen off the shelf of your pharmacy or store? Or when should you stick with the brand name and so forth? And there's pros and cons of many different decisions, and that's the kind of practical information we want to convey to you so that you're an informed patient, an informed consumer when you purchase medications over the counter or when you discuss prescription medications with your prescriber. Ask Pharmative is one of my favorite ones. This is all about me being able to interact with you and be in touch with you to answer your questions. And as I stated earlier, what the heck is pharmative right now is the most commonly asked question, and I felt like this would be an appropriate venue to discuss this with you. Then another channel which I lead is the Cancer Care and Research page. And here we're talking about different cancers, different diseases, new medical breakthroughs in the treatment of cancer. Immunotherapy is one very hot topic right now, for lack of a better way of saying it. And we have some information there about different types of immunotherapy and ongoing research right now. I also want to give a shout out to a dear friend of mine, Debbie Madley, and she is writing her own patient blog and her own recovery of ovarian cancer. And so far she's written 3 installments of that blog, and so if you want to read about Debbie's story regarding ovarian cancer, please take a look. It's right here in Cancer Care and Research. Faces of Humanity is inspirational photos and bios of famous people either involved in medicine, research, or healthcare in general, inspiring figures that we feel from time to time will allow us to convey our messages to you from looking at the past and moving forward to today and the future. Kind of speed up a little bit because I know we're running out of time. I'd like to keep this to about 10 to 15 minutes once a week. Still looking for the best day and time slot. So again, something for you to message to me, whether this time slot works for you or not. We'll also have the video feed available after for playback. In Tech is all about technology. One of my passions is technology and utilizing technology. And right now I'm participating in my 2nd clinical trial as a patient, as a subject, where my smartwatch is actually monitoring my heart rate. And I'm participating in a study to collect information to see if it can predict certain types of dysrhythmias in the future just by wearing my watch. So technology is going to be extraordinarily important now and in the future to allow us to minimize costs associated with healthcare, to be more efficient at administering healthcare to you. So definitely check out InTech for technology and healthcare. Integrative, I have a dear friend who's a licensed acupuncturist. Her name is Paula Hilton, and she has created her own channel of Integrative, which is all about alternative medicine. So therapeutic massages, acupuncture, and so forth. Basically allowing the average user to receive information about alternative medicines, Chinese medicine. Living in Today is Jimmy Mann's, as creative directors, his health and beauty advice. It's all about healthy living in today. So check that out. Another channel that I'm very proud of is our addiction channel. Unfortunately, it's a very complicated disease, the patterns and the negative behaviors associated with addictions. We have some information available from various sources there as well. As a member of our team who's anonymous, who's writing a diary blog about their recovery of addiction. So check that out as well. So we have 2 patient blogs going on. One is Debbie's story on the Cancer channel, and then there's also Alexa's story here on the Addiction channel. So check those out as well. Alexa's actually a pen name, and she's actually writing it from and skipping, very much like the TV show This Is Us. She's going back in time to share different episodes of her recovery throughout periods of time. So you'll read a blog about how she's feeling today. You'll read a blog about when she first realized she needed help. You'll read another blog and may go all the way back to her childhood. That's Alexa's story on the Addiction channel. And then a few other channels that we have are Virtual Pharmacy Med Info. That's all about medications led by our pharmacy team of people providing you the best information possible about your medications. Silver Linings is another channel we have, which is all about taking good care of our seniors. And have a dear friend of mine, Maureen Reiser, who manages, owns, and operates an assisted living service out in the Florida area. So shout out to her, putting together the Silver Linings channel. And then we have two more channels to relate to you is Modern Medicine, which is basically family medicine, family health, new breakthroughs in internal medicine, and then our PHARMATIVE live channel, which is also sometimes referred to as PHARMATIVE Lives, because we're talking about healthcare for all living things. That's where you can see the majority of our video clips, and hopefully soon our PHARMATIVE live episodes will actually be streamed here live as well as on Facebook. And then finally, I'm just going to conclude with our Pharma Gives Back program. And each year we will select 10 charities, and 10% of all proceeds that we raise through advertising dollars will go to these 10 selected charities. Some of them are personal to me, but I just want to list them out in the spirit of transparency. For 2018 will be Brothers Brother Foundation, the San Francisco SPCA, the Vanderpump Dog Foundation, Juvenile Diabetes Research, Save the Children, UNICEF, St. Jude's Children's Cancer Research Center, and just clicking right here to expand the list, Desert AIDS Project, San Francisco Food Bank, and H. Lee Moffitt Cancer Center in Tampa, Florida. Those are the 10 charities selected for the Pharma Gives Back program this year. So in closing, I know we're over our 10 minutes. I just want to let you know that this is our time to kind of talk over coffee. It's kind of like the coffee talk of healthcare. And I want to let you know that we'll do our best to provide the best information to you and your families and your loved ones about healthcare. Please feel free to join, establish your own circle of friends and family members as we move forward. I expect that PHARMATIVE is going to be extremely successful. As of right now, across all platforms, we have over 15,000 members. So that's an exciting milestone for us now. I can only expect that more people will join. And the last and foremost thing as I conclude our first PHARMATIVE Coffee Talk series episode, part 1, is that I want to thank you for your time, because I know it's very valuable to you, and I want to thank you for your support and wish you the most important thing you can do for you and your loved ones is stay healthy. And we'll have more discussions like this to come in the future. So have a good day, and I'll see you somewhere on pharmative.com.